Hello, everybody. Good afternoon. My name is Rebecca Andrade, and I'm the Educational Programs Manager here at the Kansas Health Institute. And I would like to welcome you to today's webinar, Kansas Health Matters in Action, a multi-purpose tool for health, policy, and community change. We're looking forward to a great discussion about all the ways that the Kansas Health Matters resources can help you access valuable data to better understand the health of the community and ways to improve it. So again, as I mentioned, we're looking forward to a great session with you today where we will engage in a variety of discussions around the Kansas Health Matters website and resources. After a few opening remarks, you'll hear from 3 KHM partners who will share ways that the data can bring about meaningful change. Then we will have a hands-on walkthrough of some of the key resources on the Kansas Health Matters website. And after that, we will hear from a panel of experts who will share their real-world experiences with KHM. So now it is my pleasure to introduce Carrie Bruffett, our President and CEO. Carrie will set the stage for today's discussion with a few opening remarks. So over to you, Carrie.
Hi there. Thanks, Rebecca. I'm so excited for the conversation today. The Kansas Health Institute, we believe that data and evidence and information is essential for policymaking and for decision making, for the best kind of public health and population health outcomes. And what an incredible tool you're going to learn about today, or many of you are probably very familiar with, and maybe we'll learn a little bit more about today in Kansas Health Matters. So KHI is a nonprofit, nonpartisan educational organization. We're based in Topeka. Those of you probably folks are familiar with KHI, but if not, we've been around since 1995, so we're celebrating our 30th year. And I would say it's about 30 years of advocating for using data and using data effectively in policymaking. So again, this is a very timely conversation for us. It's always part of our strategic plan. How do we advocate for and partner with other organizations like those you'll hear from today to make the data more available, make it more understandable and really actionable. So really looking forward to the conversation. I get to introduce, I think here very shortly, or maybe it's about right time to introduce Tatiana Lin, who is my colleague. She is our Director of Business Strategy and Innovation at the Kansas Health Institute. She's going to kind of guide us through the conversation today, but I just wanted to join you to welcome you, and I'm really looking forward to learning more myself. Thank you.
Thank you so much, Carrie. Good morning, everyone, or good afternoon, depending where you are. Tatiana Lin, as Carrie mentioned, Director of Business Strategy Innovation. I had an opportunity and privilege to be a part of the Kansas Health Matters for over a decade now, and working with wonderful partners across the state to bring in this resource to Kansas. And so I will be transitioning us between the sessions and facilitating the last panel. So it's my pleasure to welcome our first conversation, our first panelist today, Elaine Johansson, Sarah Good, and Stephen Corbett. So Elaine, as you can see here on the photo, is with the Associate Professor with K-State Research and Extension with Kansas State University. Sarah Good is President and CEO of KFMC Health Improvement Partners, and Steve is Senior Chronic Disease Epidemiologist at Kansas Department of Health and Environment. This is going to be a very exciting conversation. We're going to hear remarks from all those 3 organizations who have been long-term partners of Kansas Health Matters, and they will talk about how they leverage that resource for their audiences, for their internal work, and why data is actually critical for the work that they do and for the work of their members. And so with that, I'll pass it to you, Elaine, to get us started.
Thank you, Tatiana. Thank you all. And I want to thank everybody at KHI. What a wonderful partner and an asset to our state. And I also want to thank everyone that's been a partner with Kansas Health Matters. I was welcomed to the partnership about 4 years ago and have thoroughly enjoyed it and continued to. And I encourage anyone that's on the Zoom today to consider becoming a partner. KHM is a Kansas-grown asset, a resource, and we can all benefit from it. So speaking of that benefit, let's go ahead and look at a Kansas map. This is part of my constituents, and I want to talk a little bit about how the people I serve, which are K-State Research Extension professionals, how they use KHM. But stepping back, I don't know if the people on the Zoom today are familiar with the Kansas Health Workers here in the state. It's a very vibrant and growing workforce. We have more than 300 community health workers embedded in communities, hospitals, clinics, health departments in the state. And I've had the privilege of training many of them in KHM through a module in their course around community assessment. And I really enjoy the opportunity to unpack KHM, the resources, and also access to community health plans and community health assessments that are located on the website. And I think Cindy will show us where those are. So actually, our community health workers use the data and use it often as they become part of coalitions, collaborations, and working in their agencies. Well, back to my constituents, these are all of the community embedded extension agents, their boards, and their collaborators. And you'll see on the slide here, K-State Research Extension is actually part of a national system of extension professionals that do education, do health programming, and health and community development across the state. And I too have trained all of the extension agents in the state around Kansas Health Matters, why the data matter, how easy it is to access, and then also understanding how data can be used to move board decisions or move community change initiatives or to put in a grant proposal. You'll see that K-State Research Extension covers all of the state. We have counties, we have district offices, and we do have volunteer board members that are up to 650 board members who govern extension, and then all of our other volunteers. So KHM is out in the field, out in the community, making a difference now. And just to illustrate, Sedgwick County, one of our extension professionals, Sarah Sawyer, organizes a hypertension program with Wichita. And she just reported to me last week, she had no idea the hypertension rates of adults in Sedgwick County alone. And she found that out through KHM. She did a comparison over years, and now she and her board and collaborators at the public health department and the libraries are really even more incented now to deal with this pressing issue of hypertension and chronic disease. So with that, Tatiana, thank you. Again, there's the constituents out there supporting KHM, and I appreciate being part of the team, and I'll turn it back to you.
Thank you so much, Elaine. It's wonderful to hear how academia, students, universities are using Kansas Health Matters and how it's helpful extensions. There's a lot of great work happening across the state. So we hope that it's informing decisions, programs, and activities at the community level. So thank you for your comments. And a reminder, if you have questions or comments for Elaine, please post them in the chat, and we will do our best to address them in writing. So with that, it's my pleasure to welcome Sarah Good, and she will talk about how KFMC Health Improvement Partners are using that KHM in their work.
Yes, thank you, Tatiana. So as previously mentioned, I'm the CEO of KFMC Health Improvement Partners. And if you're not familiar with KFMC, we are a not-for-profit consulting organization based in Topeka. And since 1972, we've been advising physician practices, hospitals, nursing homes, and state agencies on how to achieve higher levels of performance and deliver better health outcomes for patients. In addition to that, we're also a key collaborator of the Kansas Health Matters initiative. And as part of that partnership, we contribute to the development and maintenance of the platform. And I want to share just a few ways today that we use the tool in our everyday work. At KFMC, everything that we do is data-driven, whether that's internal operational improvement or assisting provider organizations or state governments. And so we believe that data is foundational to improvement. It's not just a tool, but really the foundation for informed decision-making and measurable health improvement. So as we work with provider organizations or state agencies to identify relevant data sources, both internal and external, we try to identify sources that they have easy access to. And then we we can help them turn that data into actionable insights that drive better patient outcomes and more efficient healthcare delivery. And along that same line, we believe that data drives quality and performance. We work closely with providers and organizations to analyze quality metrics, identify performance gaps, and track progress over time. One of the hallmarks of the services that we provide is really reducing provider burden through smart data use. Our approach to identifying and leveraging existing data sources simplifies data collection and reporting for those organizations we work with. Data can be expensive if you have to buy it. It can be overwhelming if you have to analyze it from its raw form. Kansas Health Matters kind of removes much of that burden and allows organizations that we work with to actually begin working with meaningful data almost immediately. We also know that using relevant and meaningful data supports population health. And so by helping us and the provider organizations that we support understand gaps in care that exist within the communities that they work with, and then we can use some of that population health data to tailor interventions for specific populations, including rural communities and underserved communities. So we leverage, even though there are 7 kind of roles of data here on this slide, we leverage Kansas Health Matters specifically in support of points 3 and 4. So first, we leverage Kansas Health Matters as a tool to reduce provider burden through smart data use. Kansas Health Matters provides an easy-to-navigate centralized hub for publicly available health data, so providers and community organizations don't have to search and across multiple sources and compile that data. This really simplifies their data collection for key activities, whether that's completing a community health needs assessment, contributing to or writing a grant proposal, or planning strategically for activities or services to offer to their communities. The platform also includes many built-in visualization tools, community dashboards, downloadable reports, which really reduces the need for internal analytics with providers we work with and really makes it faster and easier for them to meet some of their reporting and analytic needs. And so by leveraging Kansas Health Matters, providers can access data that aligns with measures that are already in use for other reporting obligations that they have, whether that's CMS or HRSA or other public health agencies, helping them fulfill those requirements without additional effort. And because the data on the site is curated and regularly updated, it really reduces the time and staff effort that they have to exert to gather, validate, and analyze data for planning and compliance. But secondly, we use Kansas Health Matters as a tool to support efforts to close gaps in care and really patient health. It provides granular data by geography, including county and zip code level views, which really are crucial for identifying disparities and targeting interventions. And organizations can use Kansas Health Matters to stratify and compare data by region, race, ethnicity, and other demographic factors. So we use it as a tool to support improvement efforts that we're helping providers with, but we also use it as a tool to support our internal operations. We have specifically used Kansas Health Matters indicators and disparity dashboards to identify specific equity issues that are consistent and common across the state of Kansas to help drive our agenda and breakout topics for our annual Kansas Health Equity Summit. We have also used the site to create and populate community level dashboards, which can help drive our recruitment efforts for newly awarded federal or state contracts and help to identify communities that have the greatest opportunities for improvement across a variety of improvement objectives or topics. So through our collaboration with Kansas Health Matters, we're able to really demonstrate a commitment internally and externally to fostering data-driven approaches in the communities that we serve. And so thank you for the opportunity to share a little bit of that with you.
Thank you so much, Sarah. I really appreciate how you provided different examples on how you're using it internally and also how your members can benefit. Love the example of easy-to-go reports that you can just look at the data and create a dashboard, as well as looking at some indices that I know Cindy will showcase some of that in her presentation shortly. So thank you for your insights. And with that, with a great pleasure, I also would like to welcome Steve Corbett. He is with the Kansas Department of Health and Environment. Steve works a lot with data. The department has a lot of different other resources that are very valuable for the state. So we look forward to hearing your perspective on how Kansas Health Matters fits with other data sources and how you use it both internally and externally. Welcome, Steve.
Good afternoon. As Tatiana said, I'm an epidemiologist for KDHE. I'm also the director of population health and maternal child health and chronic disease epidemiology here at KDHE. So lots of data. And I probably don't need to tell this group how critical data is to decision making and to understanding population health issues. Well, Kansas Health Matters helps us at KDHE, for one thing, disseminate the data that we have. One of the missions of our organization is to provide data to organizations and to the public. And so Kansas Health Matters allows us to do that, allows us to fulfill that part of our mission. A number of the grants that we receive through CDC and NIH and other organizations often require that we disseminate the results of any of our projects out to the public and to organizations. We're always able to point to Kansas Health Matters as one of those dissemination points. So it really helps to serve that purpose there. We're able to upload a lot of data into Kansas Health Matters that comes from various parts of Kansas, from KDHE. Obviously, Kansas Vital Statistics provides lots of data on things like mortality and Kansas Health Matters. We also provide data from the Kansas Behavioral Risk Factor Surveillance System, or BRFIS. That data is also utilized in Kansas Health Matters via what's called CDC Places, which provides those small area estimates at the county and sub-county levels. The Kansas Pregnancy Risk Assessment Monitoring System, or PRAMS, also provides data to Kansas Health Matters on issues surrounding pregnancy, before, during, and after pregnancy, to ensure successful pregnancies and pinpoint areas of risk. Our Kansas Cancer Registry provides data on things like cancer morbidities and mortality, so that data is able to get out there. We have a newer program that we adopted from the Department of Education called the Youth Risk Behavior Survey, or YRBS. We're hoping to eventually, once we get that data collected and analyzed, to also be able to provide that through the Kansas Health Matters website. So it really is a great opportunity for us to be able to put all this data in one single spot so that it is easily accessible to folks. In addition to disseminating data, we also utilize the data there. It was interesting that I was asked to come speak on this panel because I was right in the middle of a crisis where we needed some data. We'd had a data analyst who had put together some information sheets for a few counties in Southwest Kansas. But the data was incomplete. It didn't have everything we wanted, like confidence intervals and the source material and things like that. And the data analyst was no longer at KDHE. So people turn to the epidemiologist and say, can you get us this data and can you do it by tomorrow? So I'm thinking, I look at the listing of data elements. There's about 21 data elements for 14 different counties. And sure, I can go to a half a dozen sites and try to find this data and try to collate it. But my first thought was, I'm going to go to Kansas Health Matters and see what they have. They probably have all of the measures I need, or at least comparable measures that I can get from there. So I go to Kansas Health Matters, I go to the custom dashboard tool. I'm able to plug in all the counties that I was interested in. Like I said, 14 of those in Southwest Kansas. I found 21 data measures that were almost exactly what we were looking for, if not but really close. Run the search tool, and there's the data. And then I can download the data using the download tool. And it's all uniform in one format. I can easily look at Excel. All the columns are the same. All the measures are the same. I don't need to spend days trying to put all this stuff together. So from my perspective, it was really a lifesaver in having all of that stuff together in one spot. As an epi, I know I can find this stuff. I can go to 6, 7, 8 different places and get it. But it's a lot easier and a lot more convenient to be able to go to Kansas Health Matters and find all this data. So I want to thank them for being a lifesaver at a time when I need it. So thank you, Tatiana.
you so much, Steve. Love your examples about how Kansas Health Matters can be one-stop shop so you don't have, if you're not aware where different data set live, which organization hosted, that's one way that you can come to Kansas Health Matters. You'll be able to find different data sets and also links you to that original site. So thank you so much for bringing that example, and we appreciate KDHE work on Kansas Health Matters and being a valuable partner. If you have any questions for Steve, Sarah, Elaine, please post them in the chat. And I also want to mention that the Kansas Health Matters has a lot of great partners around the table. As Cindy will overview the site, you will see them on the site, but I also added a link in the chat where you can see different logos for the partners that are a part of this collaborative. And so with that, it is my pleasure to move us to the next segment of our presentation and session. We would really want to unpack the Kansas Health Matters toolbox. We call it the toolbox because I have so many different tools and opportunities, as our speakers already noted. So Cindy will walk us through some features and showcase it for you as well. But before we dive in, we would love also to hear from you all. So we have a quick poll that we would love you to participate in. And we would like to get a sense into how much are you using Kansas Health Matters? So you should be able to see this on your screen. So the question is, how often do you use Kansas Health Matters for your work? Weekly or more, a few times a month, a few times a year, rarely, never. Oh, I was not aware of this tool. So we'll just give you a few seconds to complete the poll. And Cindy is with Kansas Hospital Association. She is Senior Vice President, and we've been a long-term colleague and supporter, as well as contributor to the Kansas Health Matters. So thank you, Cindy, for being here today and for sharing your insights about the website.
Thank you so much, Tatiana. I'm now going to share the screen and do a walkthrough of Kansas Health Matters. Throughout this 12 to 15 minute section of our agenda, we have the chat feature available just as it's been used throughout the meeting. So we encourage you to chat with your questions as we're walking through very briefly a website tutorial of kansashealthmatters.org. I think we can see on our screen that many of you use the site a few times a year, which is wonderful. A few of you have never used it and weren't aware of Kansas Health Matters. So I won't go too fast, but for you advanced users, you might want to weigh in on the chat too with things you find are very helpful. But for most of you, some of these things will be new because we keep working on Kansas Health Matters to improve the site and add data that's important to those that use it. So with that, we'll just jump in and get started. And the poll was very insightful to this presentation. So first and foremost, the website you should be seeing on your screen, and I'm going to minimize myself, but hopefully you're seeing the full screen. Our panelists or others can tell me if they aren't, but you'll see that the homepage has a number of tabs across the front that I will walk through today in a very brief time. But I wanted to also show you, we do feature a monthly focus area, which is part of our social media campaign for the site, as well as on the website that changes regularly. Then you scroll on the homepage, you'll see quick access to lots of different things on the website. You'll be able to get to health indicators, topic areas, and featured resources in many ways, but we do feature it on the homepage. Below that, you'll see our partners, and we have many partners and funders of Kansas Health Matters, and they are located here. If you want to learn more about them, you can click there. Again, lots of different ways to get to the data. We have a very robust footer that also has frequently asked questions and more about us and tools and resources. With that, let's dive in. The first part of the site is most important is all the data on the site and all the different curated dashboards that Kansas Health Matters can bring to life. I'm going to start in the first one, which is just the community dashboard. You can click on all of those after today's call to just delve into those different types of data that are on the site. I'll only have time to show you a handful of those, but the community dashboard is one I often reference as a great source for folks to find data. You can see on the top, you can look at data on Kansas Health Matters in lots of different ways. You can look at the entire state. You can look at public health preparedness regions. You can look at counties. You can look at cities. You can look at zip codes, and you can look at census tract. Not every data set or indicator on the site is available in every type of geographic area. Many are in some areas and not others, but there would be an area covering you and your area of need, but depending on these kinds of divisions that we've set out. You'll also see on this community dashboard panel that you can look at the different curated dashboards by an advanced search by putting in a keyword. You can filter by indicators that are on the site. You can go by location. It's important to know that this site has lots of different mapping techniques. So in addition to going to finding a location on our homepage dashboard map, you can also click on this icon here to find the location on a statewide map as well. And from the statewide map, you can click on the state, you can click on the regions, you can click on the counties, and you can delve into the data on a visual map as well through the mapping features. So with that, I want to go back to the community dashboard and just kind of walk through a sample of a data set. So for example, if I knew I wanted to look for data on obesity, I could click on obesity and it would pop up all the different indices or indicators around the topic of obesity. And so, for example, let's look at diabetes. Let's look at data with diabetes with 20, or let's look at Medicare diabetes. Let's look at that Medicare population. I wanted to look at the entire state to see what the Medicare population is. So we'll take a peek at statewide diabetes. And there's a couple things I want to point out as we look at this data set. You can change at any point when you're looking at any data set, the area by clicking here under the measure to see if you want to look at something different besides Kansas, you can. You can look at the measurement period. This measurement period is 2023 data, but you can look at previous measurement periods as well, right from the top of your panel. We've named this set of data diabetes for the Medicare population, but as you can see, sometimes you want a little bit more about what that is. So we defined it, and we also say, why is it important? Why would anyone want to know about diabetes in the Medicare population, especially if you're doing grant writing or something? We have put in text about every indicator to know why that would be important to the health of Kansas for Kansas Health Matters. You'll scroll down to see the card, if you will, on this measure, and you'll be able to see the source. This comes from CMS. You can click on the source at any time to get to that data source. You'll see the measurement period is 2023, but that seems a while ago. You will actually see this was last updated in March 2025. As with all data, you're often taking a look back, and the data measurement periods will be different, but the last update will really let you know how up to date this data is. Important to note that we are updating data all the time. So data doesn't always update at the end of the year. It's not always annual. So sometimes when the data updates is when that data will be available, and those dates will be different. Important to know as you look at the comparisons, we're going to look at data and compare it to other data. So this bar here that you can see is the green and yellow and red is how we're comparing to US states. We also have a value with this data sets to US value. It is equal to the Kansas value, 24, and the prior value. And it's important to look at data and understand what these mean, and I'll tell you a little bit about that in a minute. You have a legend here on the left that really will identify what these green, red, or blue indicators mean, and it will define that for you. If you happen to look at data and see that there is some measurements below, this will give you some other ways to look at the data. This little sandwich icon here will say, I really like how this map looks. On Medicare, I'd like to download it from my report so you can get a JPEG, PDF, or CSV file. So there's different ways you can look at the data. Let's jump into the next area, which is up here in our chart. Let's take a look at social determinants of health data. So we'll go to our social determinants of health dashboard, and you'll be able to see here on this dashboard, we see a lot of different sets of data. This is where you'll see a lot of those colors with the legend will be helpful, but what if you're colorblind? There is a mode right here where you can click and see the colorblind help, like green is good, but there's the thumbs up, red is not great. I love how Kansas Health Matters shows trending data. So for example, if you wanted to look out here to the student to teacher ratio, you could see we're doing well here compared to the others in the US, compared to the US value. But our prior value, we're not doing as well as we have been, but we're trending in the right direction. So this kind of gives you that information you might need when you're talking about data across Kansas Health Matters. Let's take a peek and also look at this button right here by the color mode. I'm going to turn color mode off. This is what I call a card. So these data can be taken with you. You want to take the data with you, whether it's in a report or an email, you can actually save the data in a card. So you could look at any of these data sets. For example, high school graduation rate, and you could put this right to a card and save it, or you can learn more about it. So there's a couple ways to look at the data in Kansas Health, or multiple ways to look, but that's one of the ways you can take the data with you. Let's take a peek at another area, which is families living below the, well, let's go with a report card builder. I'm going to jump out of the data because of time, and let's do a report builder. So if you want to make a report on Kansas Health Matters, you can also customize your reports. Lots of different ways you can do it, but you're going to select a location. You're going to select what you want in your report. So maybe you wanted some key indicators around obesity. So you're going to select those. When you pick your indicator, you can also select how you want it to look. So if I want to show adults who are overweight or diabetes, I can see that I can show it in a chart, a gauge, a card. You can pick the different ways. You can customize your report in many ways, adding graphics, pictures, and text. I'm just going to show you one that was pre-done. This is how the report would look. Focus on healthy weight. I added a picture, text, key takeaways, and here are the different data that I selected to show in my report. And this can all be saved and grabbed as a downloadable PDF that you could add to, for example, your community health needs assessment or improvement plan. So wanted to also show, before I run out of time, the data scoring tool. You can actually click right there. I'm not going to leave the site. I pulled up the data scoring tool to show you what this looks like. This is an example of the data scoring tool that you can see the state in values of the different indicators right here with the red, green, yellow color code. And it would tell you more about how they get this. If you want to go back to the home page and click on how they come up with it, you can actually delve in more to the how. I will show you one other area that is really new since we've been working on the site, which has to do with the food, health, and mental indicators. We used to call these social indicators of health. I'll pull up the food and security one. I'm gonna go ahead and leave this page so I can pull that one up. And you'll see here on the food insecurity dashboard, if I can get that one pulled up, that you can look at it in a lot of different ways, just like everything else in Kansas Health Matters, but you want to know how it works, you can click in the how does it work. But for the example, the food insecurity dashboard, we'll see the whole area of the state, and you'll be able to see the map is in color coded with the greatest need being darker. So this is the Kansas map. You can search by different locations and indicators. And for the sake of time, I'm just going to jump into one that I already have mapped out here for Shawnee County. So one great thing about these different indices is you can see, like for this county, Shawnee County, and I can actually break it down by zip code. So you can see in this one county how the different values for food insecurity are reflected visually. So, and then if you scroll down, you'll see all the detail you would need about the different zip codes in this county and what the data means. You could take that out with a CSV file, as was mentioned earlier, if you want to take that into a table and work with it. One thing I neglected to show you that I don't want to miss is when you're in data, for example, let's go back to that dashboard. Let's pick anyone. We'll go to obesity data and we'll look at the data sets. We're going to pick that diabetes data set. And I'm going to just pick city. And then when you scroll down with adults with diabetes and you get to the bottom of the page, a lot of people miss this. So I always get questions about this. Scroll down, because that is where this site has a lot of magic. It connects all the different things that are related to adults with diabetes. So if you're interested in learning about data, there might be other things that would help you as you're going down that path, like promising practices, like resources, like funding opportunities. So it's very important to scroll down here because you'll also see other indicators related to adults with diabetes that you might want to learn more about. So take a look and scroll down when you're in indicators so you can see all the other resources related to those indicators. It's really important, I think, that you take a minute to do that. So back up to the home page. I've walked through the data tab with lots of different ways to look at the data. It's curated many different ways. We've looked at some of the tools, such as building reports and data scoring. We also want to highlight before I close promising practices. You can search for them or submit them, but let's just show you that page of how you search for different practices. As you can see, this page is full of different promising practices. On the right side, you'll see there's over 2,000 in the database. This is worldwide. Healthy Communities Institute, which is our partner in this site, keeps those up to date. You can search for specific practices. Let's stick with our keyword here. If I was looking at obesity as a topic and I wanted to look at promising practices that were evidence-based, I could pick that. I could also look for practices in a rural or urban area, and I would be able to search, and I would just click, I'm going to do an urban area, and I'm going to click search. And you can see there are 15 already evident practices, evidence-based, that could help me as I'm trying to tackle this issue. So you can go in and play along with this. The great thing about the practices, when you look at them, you'll actually click into them and be able to learn more about the practice, what the goal was, what the impact, and actual contact information for who did this work and how to get in touch with them if you have more questions or want to ask more information. With that, I just wanted to showcase one more area, which is our build a custom dashboard. I didn't highlight that earlier, but you can build your own dashboard. If you're interested in that, you can pick different areas and different, I think that was something we was referred to by one of our other speakers, how you could curate that, and then it will tell you exactly what you want to do. If you're like in an area where you're serving multiple counties and you want to look at multiple indicators and compare them. So with that, I feel like I've probably tapped out. The time was allotted for this. My only other plug is look at the resources, look at the initiatives. If you are working on community health needs assessment or improvement practices, there's a whole area on the website that walks through the steps to do a community health needs assessment, how you prepare, collect, engage, develop, implement, and train on those and that work. So with that, I'm going to turn it back over to the group.
Thank you so much, Cindy. We hope that you all found very helpful this quick overview of the site. We do want to remind you that this recording will be available on the KHI website about a week from now. So if you wanted to go back and look at some of those resources in this recording, you'll be able to do that. Also, at the end of this session today, we'll have an opportunity to offer you take a quick survey. And in the survey, we're asking what type of resources on KHM you would like to deep dive into. So we hope that in the future, will offer additional webinars where we can dive a little bit deeper into some of those parts of the KHM website. So thank you very much for staying with us. So and Cindy, thank you for your presentation. With that, it is my pleasure to move to our last but very exciting part of our session today. So stay with us to hear from a real-world perspectives on Kansas Health Matters. It's my pleasure to welcome Charlie Hunt, who is the director at Johnson County Department of Health and Environment, and he will provide some insights what that means for public health, what it means for local governmental public health agencies, and how they use it internally, externally. And as well as Erica Johnson. Welcome, Erica. She's a director of marketing at Wilson Medical Center. We love to see hospitals as well using this website and also collaborating with governmental local public health on different initiatives. So welcome to the panel, and I look forward to moderating it. Before we jump in, Charlie and Erica, anything you would like our attendees to know about your background?
And I'll just thank you for the opportunity to be here. It's an honor to talk about this this tremendous resource that we have in Kansas.
Absolutely. It's a pleasure to be with a room full of like-minded people, and I am just learned about 2 or 3 other things that I didn't know just from Cindy's little overview. So I am happy to share just a little bit of my perspective with you guys today, and hopefully it helps you all in the future.
Awesome. Well, just to get us started, I'll be very curious to hear from both of you. What one unexpected way you have used Kansas Health Matter, or if there's any particular creative application you see for the Kansas Health Matter in the future? And I'll go ahead and start with you, Charlie.
Great. Well, thanks again. Well, first, I want to say how important Kansas Health Matters is as a tool to understanding the health of communities. I was fortunate and very proud to be involved in the group that helped launch Kansas Health Matters a number of years ago. And at that time, the idea was to develop Kansas Health Matters as a tool that could be used by local health departments and hospitals, community health centers, and other organizations to support the community health assessment and community health improvement work. And I've often said that the way I view Kansas Health Matters, it's the high-tech version of the 3-ring binder that KDG used to produce with the county health profiles. It used to be much more difficult to get data to the community level, and Kansas Health Matters has made that much easier. And I will say also that there are other tools available out there, and I'll just go back to something that Elaine said, and having a platform that is designed and managed and locally funded is critically important, particularly right now with the future of budgets being so uncertain with what's going on at the federal level. And we know that that's at risk. I think that there's been an intentional effort to provide data that enables us to look further upstream at factors that influence community health, such as economic, education, housing, transportation, and civic engagement, things such as voting rates, just to name a few. And I appreciated the demo that Cindy gave to highlight some of those things. But the other thing I think it's important is if we understand the value of those upstream data with respect to the role those factors play, the availability of those data give communities more power and voice to understanding what's going on with the health of the communities. Those of us that are in larger communities have the luxury of having a lot of data available to us just because of the larger population size. But smaller communities with smaller populations oftentimes don't have that data available. But by having this platform and looking at the social environment, the structural environment, can really help make important information available to a broader sectors in the communities at the local level. And so I think it's really, really important.
Charlie, that was perfect segue, because I was just going to kind of frame that I'm going to speak to you all on in a way that comes from a rural hospital. And so we are very small, and my work with marketing really blends that storytelling element with strategy. And so I'm representing kind of this marketing and communication lens, and just really focused on how to make data human and accessible and actionable. So maybe not unexpected, but a very consistent way that I use data in Kansas Health Matters in particular is through our community grant applications. And just most recently, I had to use Kansas Health Matters for a grant request to put a walking path around a pond. And I used the data from Kansas Health Matters, kind of circling around the obesity rates and some of the physical activity access points. And I really was just trying to show the need and frame the why with evidence, because in my world, I love both. I have to have both. I have to have that storytelling element and the data to back it up. So an unexpected way I use it that I think might be helpful to some of our organizations is to use Kansas Health Matters to be a source of inspiration for social media storytelling. I can say it two ways. I can take a statistic or a data point and turn it into a post that's a little bit more personal or at the local level. But then I can also flip the script and take a post and back it with data from Kansas Health Matters. So I really like to have both of those things in all of our social media posts. I think it's a really great way to show credibility, but also some fun and creative storytelling too.
Erica, I love how you brought the storytelling, the importance of, data visualization and with the storytelling piece. If I can just kind of piggyback on that, and I was wondering, how do you, when you go to this website, public health data can be overwhelming. What is your strategy to really approach the data, to make sense out of data, and what tips you would give to others about it?
That's great. I'm glad that you asked this question because I recently had to speak on this storytelling framework before, and I call it faces and facts. And I'll tell you a little bit about it. The data and the telling the why and the what really comes from a place where I'm trying to marry both of those elements together. And so even in campaigns and in grant applications, presentations, all of those things, I start with a strategy that's really simple. I take a single data point that's very clear, very concise, and I think creatively about a real life connection. So for a hospital, that could be a patient testimonial, or it could be an experience that I've had being out in the community and knowing my audience. Somehow finding a relatable feature that I can back a face with a fact with. And then at the end of everything, I always end my invitation with a call to action. And in the marketing world, we call it call to action. And it's the reason why I want someone to do something or someone to make a decision, like a board making a decision about our hospital or strategic planning. So we lead with the facts, and then I kind of open the door with some of the storytelling. So I always say that like stats open the door for us, but it's the stories that close the deal.
Awesome. Thank you, Erica. Great quote for sure. Charlie, now thinking about this theme of connecting the dots between, using the data that Kansas Health Matters, what have been your experience or your agency on using it between the programs connecting the dots, partners, or community work?
Sure. Well, we actually just completed recently our updated community health assessment. And one of the things that we have been interested in is looking at life expectancy at birth and the differences within the county. And we know, for example, that there's quite a range in terms of life expectancy, 12 years in some cases. In our most recent community health assessment, we used Kansas Health Matters to explore life expectancy at birth by race and ethnicity, and found that there indeed is a difference as we expected, and that'll help us engage the community around these issues. Again, looking further upstream at those issues that really drive things like life expectancy. But in addition to larger projects such as our community health assessment, we're also beginning to explore specific topics and publish data briefs that can be used to tell some of those stories that Erica was just referring to. And Kansas Health Matters serves an important platform for us to access the data, not only for Johnson County, and this is a really important aspect of this. We're a larger health department. We're fortunate to have epidemiologists and analysts on staff that can do this work. But it's important that we're able to compare our community with other similar communities or even other communities in Kansas. And so having this platform that can give us easily access to those data can be really important. Perhaps one of the most recent examples with some of this work has been a data brief on excessive alcohol use that we published just a few months ago. And Kansas Health Matters was very useful. We examined binge drinking in particular, and the data indicate that in 2021, nearly 20% of Johnson County adults reported binge drinking. And it highlighted the fact that we have higher binge drinking rates than 3/4 of all Kansas and U.S. counties. But we're doing some social media posts about that to try and raise the issue around the importance of this in Johnson County.
Thank you, Charlie. Again, just your example illustrating how many different applications from community needs assessment to bring the data in some issue before examining the issue and making it accessible to the community. Thanks to both of you. We always wonder, because Kansas Health Matters partners are really invested in making sure that this is the site evolves with the time and provides timely information. So we consistently thinking about it, what can it evolve and what can become. And so if you could design, the next version of Kansas Health Matters or make, some changes to the features, what insights would you like to offer on that?
Well, I think to some degree, I think it depends on the type of user and what they're hoping to get out of the system. I think overall, I think Kansas Health Matters is very intuitive. I think a great place to start, and Cindy mentioned this, and that's the community dashboard, which really provides a nice overview and snapshot of the selected community. The tutorial and videos and FAQ section are terrific. So I would say start there.
I would definitely echo what Charlie just said. It's always been a dream of mine to figure out how on our hospital website that we could somehow ingrain some of the data from Kansas Health Matters. And if I could pull that in and spotlight some of the county level health indicators, and then tie in some patient testimonials, some sort of success stories, that would be like the cherry on top for me.
Awesome. And that really brings me to the next question, thinking about if Kansas Health Matters disappears tomorrow, which I know we are very committed to keep it going, but we would love to hear from you what one particular item or, from the site you would be the hardest to replace.
Oh, that's a really tough question because I am in love with many of the different tools and resources on Kansas Health Matters, but I hands down would be really disappointed if I didn't have that credibility and the convenience of Kansas Health Matters. I think you said it earlier. It is a one-stop shop for health indicators that we use for grant writing. We use it for outreach planning. We use it for community presentations. And I will be the first to say that I just don't have the time that it would take, like Steve alluded to. I don't have enough time of that resource, that valuable resource to go in and pull from different sites. So Kansas Health Matters, especially those comparison tools, those are just such great visual aids. And I always say in marketing, I like to have the visual and I like to have that audio and I like to provide that criteria in both of those ways, depending on what audience I'm speaking to. So I would miss that shared language for sure, especially when speaking to a group of people that are on this webinar today, these public health professionals, these funders. I think that it helps everyone start on the same page, which is crucial.
Wonderful. Thank you so much, Erica. Charlie, is anything specific to you that you think, for public health community and local governmental public health could, miss the most if such site would go away?
Yeah, it is hard to pick just one thing because there's so much that is useful from it. Again, I think that one of the greatest values of Kansas Health Matters, again, is the ease of use and the accessibility of it. Again, there are lots of other platforms out there that we can go to, but the ability for us to quickly query and not only have the data tables available. I'm one that likes to have the data tables, but to have the visualization right there with it, I think is really, really important. And lots of times we'll go on the site, we'll do the query, get that image of that chart and download it or screenshot it and pop it into a quick document. It really is a nice feature to have.
Wonderful. Well, my last question for both of you is thinking about those that might have had some experience with the site or maybe just today learned about the site and would like to explore it. So put yourself in those shoes. I know you've been, visiting the Kansas Health Matters, be familiar with it for a while. What advice would you give to those who are just beginning to explore the site, how they can make the best of that time, their experience?
Sure. I think Cindy kind of hinted at this before, but there is that search feature. I would really encourage people, just try not to do everything at once. Go to that search feature and just search one topic that's of interest to you and don't have a goal in mind or a data point that you're looking for. I encourage you to kind of just take the time to see what sticks out to you. So things like mental health, maternal health, food access, just see what kind of is speaking to you and take the time to go through and see what kind of things you can pull out and creating those dashboards. The county snapshots are a gold gold mine for any of your board presentations that you have or community briefings with your city council. The county snapshots for sure is something that I would encourage everyone on here to explore. And then lastly, use the site to support stories that you're already telling. Many of your organizations already have marketing initiatives. They have voices and stories already out there, but I encourage you to go to Kansas Health Matters and plug in some of the data and the evidence and the proof behind whatever story you want to tell or whatever action you want people to take. And I think that that is what really strengthens your messaging.
Yeah, I don't know that I have a whole lot to add other than things that have already been stated. I would say that there's no need to go it alone. Looking at the results of the poll from earlier, that there are a lot of people that have used Kansas Health Matters. Again, it's been around long enough that there really is a breadth of experience with across the state. So I would say don't be afraid to reach out to colleagues at other organizations that have utilized Kansas Health Matters. I think they can be a great resource. And as I mentioned earlier, the tutorial videos and the FAQ sections can be really helpful.
Wonderful. Well, thank you so much, Erica and Charlie, for joining and providing your insights of how you use it, your organizations are using, for inspiring us to go there and try it. We look forward to kind of continue this conversations, collaboration across the state. And with that, I'm going to pass it over to Rebecca to wrap us up.
Thank you so much, Tatiana. And thank you, Tatiana, for guiding us through today's webinar. And a big thank you to all of our speakers today for contributing your time and sharing your expertise, your perspectives, and experiences. It has been very valuable for our audience today, so thank you. And we'd also like to thank everybody who joined us today. It was great to be able to connect with you and hear your questions and your comments and chat in the Q&A. And so as today's speakers have encouraged, we would like to continue, the momentum towards this. And so you'll find the link to kansashealthmatters.org in the chat. You also have the QR code here. So again, we encourage you to hop on the website and explore it and see how that data can be helpful for the work that you're doing. And as Tatiana mentioned earlier, we would love to hear from you and what topics and questions you still have about Kansas Health Matters and this data and how it can be used. So I'll pause here for a moment to give you a chance to click on the link in the chat or scan the QR code to access the feedback survey. And so in there, you'll find a few questions asking your thoughts about today's event, but also very importantly, asking, what topics or specific areas would you like more information on? And as always, we are here to connect. We would love if you have any questions or as you walk away from today's event, if anything else comes to mind, please reach out and we'd be happy to help answer those questions or connect you to the resources that would be of greatest help. And with that, thanks again for joining us today. It was really wonderful to share this space with you and we hope you have a wonderful rest of your day.